some of the website and issues. Oh yeah, I forgot to tell you guys that the meeting is being recorded. We always record it for the purposes of you guys being able to review this and spreading the message. So a quick disclaimer is that I am a consultant. I'm an outreach trainer. So by no means this is going to be applicable to all of your particular types of situations or your particular type of activities or industry. It is for awareness only, and I'm facilitating today some of the updates and news in the Cal OSHA environment. Okay, we keep going. The Cal OSHA's homepage has great general information for workers on one side of the equation and great general information for employers. So Lindsay, if we could go to the Cal OSHA homepage.
Yes. Okay.
In recent years, they have developed and they have improved their website. And this is great news because in the past, we really didn't have a good website that gave us tools. Cal OSHA has developed e-tools for us. And of course, in this front page, as Lindsay's scrolling up and down, we can see what Cal OSHA basically does is develop standards, the rules, right? And then they also enforce them. And last but not least, they give permits out. So if you stop right there at the middle, Lindsay, where it says employees, workers and employers, that's a very important portion of the website. So we have information for workers that has to do with, you know, labor disputes, health and safety rights, protecting temporary employees, reporting a labor law violation, reporting employers in the underground economy. So some of them are not directly safety related, but they would be very helpful in case a worker is going through any of these things. And then a very important tab right there on the worker side of the equation is the Young Workers Program. The summer is around the corner, guys. And a lot of you in today's call hire a lot of young workers on temporary basis or just for the summer. You even have people that come back or have been coming back for the last couple of years for their summer time. And they make money during the summer, so they like coming to work for you. And I have good pointers in that regard. So if we click on the Young Workers Program, that would be great. At the very that one is beautiful. So there is an actual page that has to do with, you know, if you are a teenager who is working at any of these types of industries, and if you scroll down, there's an actual list of different types of partnership for young worker events. They do competitions, they do publications, they do posters. The whole idea behind this is to bring awareness to young workers on things that your employer may be doing that you have to raise your hand and say, hey, you know, I'm being exposed to chemicals, but I haven't had training. And just because they're there just for the summer doesn't mean that you don't need to train them per the regulation. In fact, you do. If we go back, Lindsay, to the main page again, so we're just kind of exploring right now. The other side, so we see a list of everything for workers, and also they do have there a flag on file a complaint. This is how workers, employees get to file complaints with OSHA. And they get to either do it formally by downloading and filling out a form, which you don't have to click on it, Lindsay, but filling out a complaint formally with OSHA allows OSHA to make a decision as to whether or not they want to go to your site. So depending how serious the actual complaint is, let's say they're talking about dust in the air, and if there is dust that they're breathing and they're going home and feeling in the back of their throat and they're starting to get concerned, they go to the doctor, and the doctor says, well, you know, dust, breathing dust, depending on what it is, it could be flour, it could be anything that they feel it's a danger. The doctor could actually print out a page from OSHA's website that says that it is dangerous for the health, and they could pick up the phone and complain. So it is important for you to know that this is there, that this is how OSHA could also get to your site. Now, on the employer side of the equation, this is all information for you. There's actually a way for you to click on reporting a workplace accident. Some of you that have followed us through the monthly sessions know that you're supposed to call Cal OSHA and pick up the phone and call if you have a serious injury or illness or an inpatient hospitalization, no matter for how long. If they get admitted to a hospital because of an injury at work, you are supposed to pick up the phone and call. And so you got there that button that says report a workplace accident. You don't have to do it right now. I wanted to explore some of the other things before we keep going. Required for employment. So if you have a question as to how many posters you need to have up, notifications, record keeping, there's the link right there. And I love this. Services and partnership programs. Consultation for OSHA is one of the services that Cal OSHA gives that very few employers take advantage of. And so I do want to talk a little bit about that. So would you mind clicking on consultation service and partnership programs, please? Right there, second one. Oh, yeah. This is, you call your own branch. So you have a district office near you, and they would assign an actual highly educated industrial, not all the time would be an industrial hygienist, but it's some person with industrial background that could get to you and that would walk your floor and help you fix a lot of the issues for safety. So this is without cost to you. The walkthrough, the inspection. Trust me, I've been doing this for a while, so I know this can be very costly for your company, and the thousands and thousands of dollars just to get someone like me to go out there, take pictures, walk with you, start a conversation, make recommendations, give you a report of findings, all of that. It's very costly. And then the cost of implementing all of these issues. With Cal OSHA consultation, what you get to do is you get to actually get someone to do all of this without any cost. The cost comes when they give you deadlines to fix certain things that may be more of a concern and you need to fix immediately. And so you work with them back and forth as to budgeting and deadlines. And so it does become something that you need to be ready for. So make sure you have the budget. Most companies do have a budget for safety. So why not? I mean, really, really ask yourself, why am I not doing this? What is stopping me? We do have the budget. It's not going to cost us to have them come out. So if you want a recommendation, I do have a couple of agents in the consultation side of Cal OSHA that I'm acquainted with. That doesn't mean I work with them, for them in any way, shape, or form at all. I'm just recommending their services. And because I've been calling Cal OSHA on a repeated basis, they've heard my name, and I would be able to tell them, hey, this company wants to get you on board. And then they will get you involved, or they'll talk to you about getting into one of these partnership programs. And depending on the level of that partnership program, you even get exempted from inspections because they know you've been enrolled, you are making efforts towards compliance. There's a lot of good faith going on your part to get everyone safe and healthy at work. Okay, enough of that. I know it's not a commercial. It's just really a tool. Guys, I'm all about tools and making this practical. So if I know already that Cal OSHA consultation services are really, really great to bring to you, and I know someone expressed interest, I will send it to you. I will ask Lindsay to distribute this information after today's webinar. Thank you, Lindsay. Okay, going back to that list of services for employers, we have permits. One of the permits that I see most of the time being violated by everyone on today's class would be the compressed air tank permit. Many of you have tanks on site, and these tanks, when they exceed a certain capacity, when I say exceed a certain capacity, I'm talking the very small tanks do not have to have a permit, a small compressed air tank. But when they get to be medium sized to larger, the kind that you get to stand up and, really big tanks, those need a permit. And you have to pay for it, and Cal OSHA has to issue the permit. So there's a form, you click there, and you're going to see, if you wouldn't mind just going through the permit regulations. So there's one that says compressed air, so it's not a little bit lower. Construction cranes. Maybe under vessels. I need to know study teachers. No, keep going. But as you can keep going, oh, maybe we passed it. You can see a whole list. Pressure vessels, please, under the P, pressure vessels. There we go. And you're like, I don't have anything like that. Trust me, it doesn't need to be that large. It's just any tank. So you click on the word tank right there in blue in that first paragraph. And then you're going to see, the form is not there. Go back. That's a regulation. And that's where you would find what size of tank needs to actually, there you go, pressure vessel inspection request form. So they get to inspect. They come to your site, they inspect, and they give you a permit, pressure vessel inspection request form. So click on that, please. So I know many of you are kind of like raising your eyebrows and thinking, what, really? Yes, many of you are using compressed air in your shops. You use it in your manufacturing plants. You use it in your wood shops. You use it for many different reasons and applications. And your tanks are quite big. So look into either downsizing them if you don't really need a tank that is larger than, I think the capacity is 3.5 liters. It comes in liters, I believe. I don't have the exact number, but I will also distribute that information with Lindsay. What I want you to know is that if it's a medium size or large tank, you need to have a permit. Here's the form, you need to submit it. Most of the time they come and inspect on your site, but they're very friendly because they know you're making the effort to comply with this. They will only go to your tank. They will not do a walkthrough inspection unless there's something really glaring in them, like someone on a ladder at the very top step. Then they may actually want to call your attention on that and inspect or call enforcement on you. But really, truly, it just takes getting to that tank and getting that permit. So this is something worth looking into. Call me if you have a question, and I will send the exact information about the actual size. But I know that the small little tanks, you know, you don't have to have a medium size and above, you do. Okay. Let's get to the next on the list. So we got to permits, and that applies to most of you on the call today if you have a compressed air tank. And then just payments, invoices, and penalties, you don't have to click on that because that has to do with any of you that are involved with a OSHA inspection and wants to appeal some of those penalties. Developing an injury and illness prevention program, huge help for those of you that have not even an idea of where that program is at. This is the #1 most cited standard in California. And we had this topic like a month ago, Lindsay, I think, or 2 months ago, where we talked about the 10 top most cited. And so if you do not have or have not reviewed your injury and illness prevention program, and that's for all of you on today's call, you have to have an injury and illness prevention program that is updated every year. Appeal, and by the way, you're going to say, where do you find that? Okay. It doesn't say updated every year, but it does say to have it that it is effective. So many times if your facility changed, downsized, or you have new machines and your injury and illness prevention does not reflect it, it will not be, it's not reflecting those changes, it will not be effective. So it's a good idea to review it every year. Then appeal to OSHA enforcement action and developing a heat illness prevention program. So the second and third most cited program or standard in California is your heat illness prevention plan. And so no wonder why they have it right there in the middle of the homepage for OSHA. A heat illness prevention plan. Every summer, they will stop any other activities and pull any inspectors from wherever they are, and they will ask them to come and go and inspect outdoor places of employment. Mind you, this includes also warehousing. Warehousing is one of those types of operations that brings the issue of heat illness, indoor heat illness. Many warehouses, and I know many of you are here opening your eyes thinking, oh, yes, I do have a warehouse, or we do have a storeroom, or we do have a portion of our building that is not currently with AC, and workers are there, and during the heat months, it gets to be 110. They're covered, and these people are going to go out there and inspect. So update your heat illness prevention program. Do training before the summer gets here. We're actually holding some classes for supervisors to attend. I think in May we have one coming up for heat illness. So make sure you enroll. Okay, so if we go a little bit lower in that homepage, I want to get to this. Ooh, these are good things to know. The actual featured safety and health guidance and resources portion of the homepage will give you a behind the curtains look as to what OSHA is focusing on. So I really love this. As much as now you had information about, hey, employers, mind you, be careful with this. And I love that synopsis right there that we just went through. You know, they want you to have your injury and illness prevention program. They want you to have your heat illness program. They wanted to make sure that you know that you have to have permits for certain things, and there's a whole list on permits. And for those of you that didn't know it, compressed air tanks bring some of the issues to everyone on this call because you didn't even know you had to have a permit, that type of thing. But then they move on to this portion, the blue portion right here on your screen. And you need to know that Cal OSHA gives priority to these safety issues. So number one, I don't think anybody on this call is involved in any of the adult film industry, so we'll skip that one after a chuckle. And then the cannabis industry health and safety. You're going to find a ton of information. I've been through that before, especially when they first put this in their website. And, you know, it has to do with common hazards. If you click on it, Lindsay, for the cannabis industry health and safety, a lot of the things that you see here apply to many of us, especially if you have a distribution center, laboratory and testing and manufacturing. So it's worth taking a look, even if you do not cultivate and distribute cannabis. If you touch just on electrical hazards, you're going to see that many of these things apply to you. Exposure to airborne contaminants, what could that be? Flammable liquids and gases. Ooh, I do have flammable cabinets. I wonder what that's all about. Hazard communication, chemicals. Am I really storing and handling chemicals in a good way? So that list should give you an idea of how OSHA would look at any company that has distribution and manufacturing, such as in the cannabis industry, right? So let's go back, just kind of an overview of what they want you to keep an eye on. COVID. Okay, COVID has been on this page for a while. Couple of years now, if you get my drift, you're all tired of it, but I'm just going to quickly just click on the COVID-19. Just so you know, the FAQs will give you the best overview of this whole program. And the main issue here, so you all make your notes, is you're not required to have a program. Do I recommend that you have a separate program for COVID-19? I do. Just because throughout these 2 years, they pushed it so much, and now they say you don't have to have it. You can just put it as part of your injury and illness prevention program. What does that mean? It means just have a separate policy. What are you doing in order to keep people safe whenever there's somebody with symptoms? And so there is an actually downloadable program where it says educational materials and other resources. There we go. If you click there, and then you get some updates on face coverings and masks. At this point, right now, guys, face coverings are only to be used by those who come back to work after being a positive case, and then they are recovering from it. They have no fever. There's some current guidelines that say for 10 days you have to wear your face covering. So you just click on that on your own later on to take a look at those recommendations for face coverings if you do have questions or issues at your place of employment. Then in regards to the program, I do want you to download it and make sure you have a COVID-19 program. It's at the very end where it says model written plans. Oh, right there, not very end. Lindsay, right there, you're there. Model written plans and programs. COVID-19 model prevention in English. When you click on it, it'll download the program and it'll guide you through what they want at this point. And it's basically testing whenever you have close contacts. Why? Because if it's at work, you don't want any more workers to be spreading COVID-19. So although now you're not required to have a written separate model program, do I recommend that you do? Absolutely, yes. Can you go ahead and back up a little bit, please? Thank you. I didn't make it back to my meeting, so thanks. Okay, guys. Okay, now back again. If you have any questions in regards to COVID-19, you can also email it to Lindsay. She's really good at sending me any questions, and I will respond. There's really nothing very new in regards to COVID, except that the program is not required, but I still recommend you do have that model printed out and compare it to your current policy. Please, please don't forget to do that. If you don't do anything else, that's a good exercise for you after today's meeting. Go ahead and print out that model program. Lindsay just walk you through. Click on it, download it, and compare it to your current policy. And make sure that you're doing that they're asking you there. That's my best recommendation. Then you get into domestic workers and day laborers. You don't need to click on that. A lot of you on this call do not do that kind of job unless you are the owner of a cleaning agency, for example, that sends out workers to clean homes, or that you employ day laborers. So what this is new, and the brand new button, red button there, just means, and I'll just give you the synopsis, that OSHA is putting some guidelines. So there's no standards yet. And this is where coming to this update once a month free webinars is super helpful. And you're thinking, but why? Because now you know that OSHA is slowly walking themselves towards coming up with laws, with actual regulations for domestic workers, like cleaning people when they go to different homes, or day laborers, like someone that you hire to paint inside your home, or to come and move things, or to refurbish your garage, or to a crew to do cleaning of your entire home, whatever. Those kinds of workers, if they are through a company, create an issue of a workplace, and that has not been regulated for the longest time. And now you have some guidelines. Mind you, they're guidelines, they're not laws, but this is something worth looking into if you have this kind of business. Next, the Ebola virus information that has been there also for a while. It has to do, that's old, so I'm not going to click on it. The heat illness prevention, we do have classes coming up in regards to the heat illness, and I always deal with indoor heat illness. If you're interested, take the class. Now we get into the new one, which is the monkeypox virus. Now, many of you on this call do have a ATD, or aerosol transmissible disease program, that is compliant with regulation 5199 of Title 8 of California Code of Regulations. If you do, I really invite you to take a look at this new information for monkeypox virus. It has to do with the fact that there has been more cases, and it's related to smallpox, really. And there has been more cases, so you're thinking, how do I make this information work for me? Go ahead and click on it, please, Lindsay. The way you make it work for you is you are going to take a look at your aerosol transmissible disease program. And for the people that are occupationally exposed, you want to bring this to their attention. So in your next safety meeting, you want to say, you know what, there's a couple of new information in handouts and CDC response literature in regards to monkeypox virus and the new cases, because we do have an increase in the number of cases here in California. So training and information, that's what you need to add in regards to monkeypox virus. There's a CDC webpage link. If you click on it, please, Lindsay, there we go. You can get more information. Now, for the CDC, you get things such as, what if you're a patient, if you're sick, symptoms, etc. What you want to do is to make sure that workers know the signs and symptoms so that they're able to recognize it and always be in communication with either your nurse director or the administrator of your aerosol transmissible disease program. Why? Because they're the ones that are going to make the determination as to, okay, our clinic, let's say our clinic, does not treat these kinds of cases. And if you don't treat those kinds of cases, you need to refer them out. So under your program, you have certain deadlines as to how long you can keep them in your facility, right? And some record keeping issues, such as who are you referring these people to? Where are they going to be referred out? And informing that clinic or that new healthcare facility about what you're suspecting. And monkeypox is one of those aerosol transmissible diseases that, because they're within the standard, you need to have them be highlighted at this time, because your agencies are telling you, hey, this is new, we have more cases. Awareness, training, and making sure that you know how to handle this case. You have more questions in this regard, we have a full class also on aerosol transmissible disease standard and how to get updated. All right, if we could go back now to the next one, which is respiratory crystalline silica. We just finished the class this week. It went great. I loved it. The people in our class had great questions. It has to do with how do we handle, if we're not in construction, how do we do prevention to respirable crystalline silica dust? So we enlisted some resources. We went through the construction Center for Research and Training, which is a great resource for everyone. And we came up with great tools for those of you outside of the construction industry and outside of Table 1 of the regulation. And for those of you in construction or doing construction activities, you already know Table 1 has to do with wet methods, for example, when using a saw to cut brick or block, which releases dust into the breathing zone of the worker. What do we do to prevent that? And it's not about giving them a respirator. It's about employing an engineer method, such as a wet method, water on that blade, so there's no dust going in the lungs of the worker. So review that. It's still on California's main page. Safe patient handling has to do with the requirements for acute care hospitals to implement team lift protocols and machine lift protocols, because you do have devices that will allow, and this is all for the safety of who? The workers. Remember, OSHA focuses on the safety of the workers. So if you click on safe patient handling, please, Lindsay. Okay, there's a couple of fact sheets that you can download, and you know that this has been in effect since January 1st, 2012. So if you are one of those acute care hospitals and you have not put in place an actual program or protocol for safe patient handling, you would be out of compliance. If you go a little bit low on that, please, OSHA implementation policy, OSHA safe patient handling, frequently asked questions. That one, click on that one. That's a great way to start, because it says, when does it become effective? What does it require? And it does require lift teams and other trained support staff and training. So register nurse, observation and direction of patient lifts and mobilization, replacement of manual lifting and transferring of patients with powered patient transfer devices, lifting devices and lift teams as appropriate for the specific patient and consistent with the employer's safety policies and professional judgment, prohibition of disciplinary action against the healthcare worker for refusal to lift, reposition, or transfer a patient due to concern about patient or worker safety or the lack of trained lift personnel or equipment. So I love these FAQs because they really put a summary of what the regulation is requiring, which hospitals are required to develop this patient handling policy, which is acute care hospitals. If you are in that category, you're it. Just review it today that it is up to par. Download these FAQs. They will be very helpful. Okay, and we move to our next category, which would be tagging guns. I'm not going to click on it. It's just very quickly saying that the blood-borne pathogen issue regarding tagging guns is a health risk. And because we have a ton of retailers in California who use tagging guns to tag clothing and any other merchandise, we have the issue of workers pricking themselves with these needles, specifically if they're sharing this tagging gun. So basically that is information about not sharing and some protocols that would be useful. So if you have any retail or you're in the retail industry, make sure you click there and take a look at that. The next one, I do want to spend a quick minute on it, tree work safety. We could all learn from this. The tree work or this pamphlet or whole section of the website dedicated to tree work safety, it's priceless. I actually partnered, I keep going down, tree work, personal protective women. So I partnered with the Hispanic Arborist Association at some point. I shouldn't say partnered. I actually worked with the founder, and he is just really great. Jose has been doing this kind of work for a long time. He saw the need for Hispanic or Spanish speaking materials, and he developed a lot of this information. He makes this program and the certification program, certified arborist training program available to Hispanics in Spanish, and it's just such a great tool. There is the video that highlights the need to have, if you go below, not that one, if you go a little bit lower, okay, but stop right there. No, a little bit, there we go. Preventing fatal suffocation from collapsing palm tree fronds. Are you able to play it, Lindsay?
Let me see.
The first one is in English. The second one is in Spanish. I have used this in my trainings. I had in the past clients in this industry, and it's a very interesting type of industry. Is there volume?
I can hear it. Can you hear it?
As long as the rest of the people can hear it, I'm fine.
Okay. Let us know if you can't hear it.
No, they can't hear it.
They can't? Okay. I can. It's not letting me expand it for some reason, but I can put a link for this video.
And you know what? Yeah, they can watch it later. This is the
Okay.
video of an actual event that occurred in one of the cities in California. And the worker was suffocated to death by the fronds, which is the thick branches. I don't know if you could call them branches. They're called fronds because a palm tree forms that very thick part that is attached to the main trunk. And when they die, that's what the actual tree trimmers will go and take off. But they are supposed to go and climb on the outside of the fronds and then make sure that they trim them. And in this case, the worker went underneath. He climbed up to the top and went underneath and started to cut the fronds, and he got trapped. And the fronds are so heavy, they fell on his chest and trapped him against the tree trunk. So and even if there's no sound, you can see a little bit of this. Half an hour to trim the palm tree. And he never came back. California Fatality Assessment and Control Evaluation Program. Is there sound? Do they have sound?
I can hear it, but I don't think anyone else can, so I apologize.
Yeah, no, it's okay. You can stop it. And now I can just discuss quickly something that comes out of this and applies to everyone. There are two methods to safely do this. One is to employ one of those aerial devices, and there is no risk of you being trapped and suffocated by the fronds of the palm tree. The other is to actually climb the tree when you do not have the resource of having an actual aerial device, is to climb the tree and to actually climb on top of the fronds, the dead fronds, and start from the top and then let them fall. The dead parts fall to the ground and you are never under them. So what we call this is the safe operating procedure, or a safe way of doing the task. These are controls. These are steps that we actually have to discuss with workers in order for them to do a task safely. So how does it apply to all of us? The question is, for the tasks that your workers do, either on a regular basis or tasks that are assigned to them intermittently or at intervals of 3 months or 6 months, those are the tasks that many times bring the issue of injury, because we do not, or we have not developed step-by-step safe procedures, or what we call SOP. And we could go back now. You can watch this video. It's a very illustrative, very, very nice video. And it really prompts the rest of us to create those, to the homepage, the Cal OSHA homepage, actual administration of a TB testing, annual TB testing for healthcare workers. So there we go. Tuberculosis testing requirements under the ATD FAQs. It's all little letters, right? So frequently asked questions and requirements for tuberculosis testing under the Aerosol Transmissible Disease Standard, Title 8, Section 5199, which, by the way, is everything about the exposure control program for aerosol transmissible disease. So there's some revisions and updates, and it says, how should an employer determine which employees have occupational exposure to aerosol transmissible pathogens and aerosol transmissible pathogen laboratory as defined in the aerosol transmissible disease standard. And therefore fall under the requirement that assessment for latent tuberculosis infection and TB testing be made available at least annually. That is a mouthful, you guys. But what it means is that OSHA is frequently getting questions in regards to occupational exposure. Who is occupationally exposed to these pathogens? Well, obviously, healthcare. In healthcare, your doctors, your nurses, your physicians, your phlebotomists. That's a yes. There's no question. You have to offer that baseline TB testing. And then you have to make available annual testing. And to make it available, you don't only just discuss it during training, you also actually make time and develop a protocol or a procedure that they can review and say, oh, so this is how during work hours and paid by the company, I can go and be tested for TB. So it has to be made available to workers every year. The question comes to where if you have clerical workers or non-clerical clinic support staff who may work in patient care areas and they may be at risk of aerosol transmissible disease, do you have to do the baseline testing and do you have to offer the annual testing? The answer is yes, if they are involved with patient care. Now, you have clerical staff that is not directly involved with patient care and they are doing billing duties, or they have a designated office where no personnel from the patient care side comes to that area, then they're not considered to have occupational exposure. And you do not have to provide with a TB baseline testing and offer and make available the annual test. So this is a very good FAQ, but I summarized it by telling you that you have to do your analysis. The 2005 guidelines have been updated, and if you visit the CDC, you will find out that the annual testing is not really recommended, especially if you haven't had any cases or you are not working in an area where transmission is possible. And how do you determine that? Well, there's actually a questionnaire that the CDC has developed for clinics where they will ask the right questions in regards to how many cases you've had in the past or suspect cases. And depending on that, they will rate your risk of transmission at your particular setting. So you have to get a hold of that document. It's all in the CDC page, but if you had trouble finding it, just contact me and I'll help you out. Review this in case you are in the healthcare industry or you are in any other type of setting, such as, homeless shelter, emergency services, emergency providers, services such as respiratory testing for either companies, or you are, for some reason, required to comply with the aerosol transmissible disease standard, like 5199. You have it. Some schools have it because they do have a nurse station on site, and you guys do some sort of aerosol transmissible disease procedures, such as sputum collection or spirometry, lung test capacity. So some school universities have a aerosol transmissible disease standard that relates to this. Well, if there's occupational exposure, you have to make sure that you're doing that latent assessment for latent tuberculosis infection, baseline and annual testing to be made available. Here's the FAQs. I want you to take your time and ask your questions. Thank you, Lindsay. Let's go back to the main page. All right. So as you noticed, I went through those 3 red dots, which are the news. Those are the most important added issues where OSHA is right now placing some focus. The rest, valley fever information, you're thinking, what is that? That is mostly in construction. Valley fever is a disease that is brought about by a fungus that lives in the top 12 inches over soil here in California. Not every region, because well-developed areas do not have that anymore. But anytime you have new construction in areas such as Fresno, Tulare, Modesto, they do have the issue of valley fever. So if you're in any of those areas and you're connecting today and you have questions, or you're a provider or an industrial clinic in those areas, make sure you take a look at this link, because you may get people with symptoms that may look like COVID, pneumonia, and you may be looking into some valley fever cases that you didn't peg before. All right, the next thing is wildfires, wildfire cleanup and rebuilding. Whenever we have wildfires, there is the issue of quality of air and whether or not you should be sending workers to work in those sections. So for those of you that get wildfires going in your region often, please also take a look at this and develop a policy to keep your workers safe. There should be a protocol that you go by to check the quality of the air often enough so that you know whether or not workers should be in that environment. Okay, back to the last point on our page. Oh yeah, this was our last month's topic, as a matter of fact, workplace violence. We actually talked about, was it last month? I think it was last month. And we talked about how workplace violence is a general issue. Everyone in this call has to have a policy developed. And for healthcare, you actually have a requirement. And there's an actual FAQ for healthcare right there. Workplace violence prevention in healthcare. That's a beautiful page developed just for you. And we are putting together a class for you. Some of the issues for healthcare in regards to workplace violence have to do with reporting, issues for developing protocols for handling patients, especially in those settings like psychiatric clinics, shelters for the people with mental disability, etc. You have to have a program that includes how you handle people that become violent. And we're seeing a need for an in-person class. So please pitch in if you do have the interest. Lindsay will send a survey form at the end of today's class, and you will find that we ask you if you have interest in any of these topics or any other topic. Please mention the workplace violence in healthcare, whether or not you have an interest in going in person to a class where we actually develop a protocol for how to take care of violent situations at work in the context of a healthcare environment under Section 3342 of the regulation. A lot of you are not very familiar, but we did talk about this last month in depth. Okay, so any questions, please, you can chat with me. You can send me your questions by email. You can go back to my slide, Lindsay.
Slide. Okay.
I basically touched on every single of these. Oh, yes. That last slide, Lindsay, I want you guys, if you hire kids for the summer jobs, when I say kids, teens or young people, click on auto repair, construction, field work, hotel cleaning, restaurant, whatever your type of industry is, and you will find what are the hazards you're exposing those young workers to. So this is a beautiful link. It's by clicking in the main page and going to summer jobs or tips for young employees. So you can do that by looking at this sheet later on in your own time. Don't forget, it's a nice list of the hazards you're exposing young workers to, especially because the summer is around the corner. You're going to start hiring these kids, and you need to make sure you're doing training and staying compliant. So a lot of young workers die because it's, you know, something that they don't do on a repetitive basis, or they get an amputation by working in a sandwich shop because they didn't know that the actual flighter has to have a guard. That type of thing, you know, it gets to be, a little thing gets to be major. So take a look at this. The next thing on my slideshow is the temporary worker page and information. If you click one more,
Can you hear me, Alba?
Yes, I can.
Oh, sorry. I was saying, since this is a PDF, I don't think the links,
you're very low. You said what? I'm sorry?
Oh, the PDFs don't let you click the links.
Oh, I'm sorry. Okay. So all you do is just go to the main page. You don't have to do it right now because we're about to finish our class. But when you go to the OSHA main page, I showed you where the young worker link is. You're going to find all this information by industry there. And the reason why I want you to visit is if you have or you are in any of these types of industries, you're going to find a list of the hazards that you're exposing them to. So it's beautiful. Okay, the next slide is about temporary workers. We did have a full 1 hour class in this regard. So you maybe review that one on our website. You do have the recorded webinars. My next slide is exactly what we just reviewed. And I think we're done for the day, you guys. What do you think? We did talk about COVID, and yep, they developed the voluntary guidelines, safe patient handling, TB testing requirements. Very cool, with the links there. So although it's a PDF, you can actually compare this when you click, and I do have some links there. All right, guys, if you have no more questions, are you there? Okay, if you don't have any questions at this point, but you think of something after we are done, let us know, and we'll be very happy to answer your questions.
Awesome, thank you. We're going to send out an evaluation. Please let us know if you would like a certificate for CEUs, but we'll try to send out any of the links that we mentioned. But everyone should have the PowerPoint already.
Thank you so much, Lindsay. Thank you, everyone, for your time. Join us every first Friday of the month